Welcome, everyone, to the afternoon session of the Local Government Lab. My name is Laura Schultz. I'm the Executive Director of Research here, and will be serving as moderator for this afternoon's panel. The topic is Pandemic Policy Responses and Technological Innovation. I am personally very excited about this panel. I'm an economist of science, technology, and innovation, and one of the things that was fascinating about the pandemic was the technological responses and how it revealed that we had a lot of barriers, but there was a lot of innovation ready to launch, and just to think all of the changes that have happened in the past 2 years. So in this afternoon's panel, we have people who have been researching that. We have people who have led the implementation of some of those programs. So I think it's going to be a really interesting discussion. And as you listen, and are inspired to participate, I strongly suggest that you add your questions to Q&A, because I think we have an opportunity for an interesting discussion after the panelists present their work, the things that they've been working on for the past year. So we're going to kick off today with Meghan Cook. She's the program director at the Center for Technology and Government at the University of Albany. In the Rockefeller College of Public Affairs. And she's going to be talking about a snapshot of perspectives and priorities from local government information technology leaders and lessons that we've learned in the pandemic. So Meghan, please share your slides and take it.
Great, thank you, Laura. Let me get set here. Hi, everyone. As Laura said, I'm Meghan Cook from the Center for Technology and Government. We do a lot of work in many areas of local government. I'm going to give you a brief overview of CTG and then jump into some of the things we've learned. So CTG is next year going to be celebrating our 30th anniversary. We work in the area of policy management and technology across all areas of government, from public service to health and human services. And we do this through an innovative model of bringing government, industry, and academia together to solve real practical problems. But as part of this role that we've been engaged in these projects in New York State, United States, and internationally, we also serve as the advisor to the New York State Local Government IT Directors Association, which is a group of IT leaders from counties, cities, towns, and villages. Now, the other group that we are the founder and convener of is the New York State City CIO Work Group. And through that, we bring together those in charge of IT and cybersecurity on a regular basis to share information. Sometimes the group is more formal, more informal, but the whole goal is to share information across the cities and all the local governments in New York State. So as part of this role, we're able to do a lot of work with these local government leaders and ask questions. Now, this slide is meant to make everyone a little bit dizzy on purpose. We find ourselves talking about the many functions that IT leaders have to carry out in local governments when they do not have a tremendous amount of resources. So if you look at the top and think about all of the county departments, all of the city departments, all of the village and town departments, and then we cataloged the different responsibilities from governance and management, hardware, software, network development, cybersecurity, citizen-facing applications. Many of the groups we talk with are responsible for the school districts, for the Wi-Fi, data management capabilities, records management. That is a huge amount of responsibilities. And if you think about just a county, you have to do that within and across all of those departments. I always say that the local government IT leaders are one of the few that have the breadth and the depth within their local government, because they know at a process level how things work, but they also have a bird's eye view. So we use this a lot to communicate the roles and responsibilities of local government leaders. So in the beginning of COVID, when the governments were going to a pause, and IT leaders who had always been at the leadership level were now even more so, because they had to move governments to a remote workforce. And so this is one of the articles we did early on to highlight how this was happening from all of the counties and local governments in New York State. And these are the top 7 things that they said to us they're focusing on. Of course, telework, we'll get into that. EOC and anchor institutions, setting those up. Virtual public meetings, trying to understand the open meetings law and getting all of the infrastructure set and then doing the user education. The next one, user education. Some people need more help than others in being able to work remotely. Cybersecurity, the perimeter is larger, so they now have to think about cybersecurity in different ways. Information dissemination, a large part of the COVID was getting the message out. There was several places that were using chatbots as a AI form to get information out, and knowledge sharing. There was lots of pockets of groups that formed regionally and then specific to position to really help each other deliver services. So in October 2021, this group of IT leaders got together for the first time in a couple of years. And as you see here, it was 33 counties, 3 cities, 6 towns who were able to be in person. And we decided to do some data collection, and that's a little bit of what I'm going to present on today. So what did we want to learn? This is what we wanted, the questions we asked. Please describe what has been the most challenging. It says to county, but we had other types there too, IT departments. Do you think that understanding has changed since COVID? How has cybersecurity changed? What are you looking forward to? What do you have to do? This is a question I always ask. What single IT investment do you think would bring the most value to your county or your government? And we always say, don't think about how hard it is to get it done. Which one would bring the most value? That's interesting to hear the results. How much ARPA money are you getting? And is any earmarked for IT and cybersecurity? And then just generally, what are the positive and negative effects? So no surprise, the most challenging is remote work. And we have stories from counties and other local governments who had their list of essential employees already set. They had maybe some laptops that weren't being used, all the way to those who had to go out and purchase them, or even some allowed for home use of their home devices. So the shift to remote work required organization and identification of who would be doing that. Emerging and shifting priorities. COVID brought up many priorities that were new. So setting up the COVID stations within the counties, public health had new needs. So they took many of the projects they're working on and just worked on the new projects. Staffing. This probably could have been called either turnover, stress, but the staffing was an issue. There was more work than there was staff. And there was a lot of stress in this because of those emerging and shifting priorities and the nature that the work didn't stop. And culture and teamwork. And so these are some of the details of what I just talked about. Culture and teamwork, one of the things that I think is interesting is that while everyone was responding together in the crisis, as they moved through COVID, then there was a diminishing sense of teamwork and just higher levels of stress. We're going to go on to the second question. I want to make sure I get through them all. Do you think an understanding of IT has changed over the last 18 months? Most people said yes. General recognition and appreciation of what IT does every day. And this translated into budget support and IT being included in decisions where non-technical leaders might have thought that they didn't play a role, but now understand it plays a role in just about every decision within the local government. About a third said no, IT continued to be, have little recognition and we don't have much changed. So how do you think cybersecurity has changed in your local government? Of course, the technical footprint has expanded. We know that people are at home. Leadership attention and funding has increased. Mostly everyone is following the compliance rules, but it's still a challenge. And we put the NIST framework up here. It's one of the things we're doing is really driving home this idea of these categories. So what will be the IT department's biggest area of attention over the next year? Cybersecurity came out as number one. Now, you could take some of the other statements in these categories and move them around, it could potentially be a lot more cybersecurity. But those who said, we're trying to meet, there's a new, not new, it's about a year old, the Board of Elections cyber regulation has a lot of requirements. So we're doing that. Modernization and upgrades, I think moving to a remote workforce revealed many of those, and they were able to talk to leaders about what needed to change. Cloud-specific projects and remote work. If you look at some of this information here, these are some of the statements. Remote work reinforcement. Everybody says this is not going away. It may stop for a little bit. We have to put in reinforcements to be better prepared for next time. So we want a more flexible infrastructure in order to support that. And of course, the cybersecurity was number one. What single IT investment do you think would bring the most value? Right now, cybersecurity investments. What we see is there's an increase of events, cyber events, and everything from outdated hardware to patching. So there are lots of things that they want to take the time to do that are on their to-do list to manage their cyber risk. Building their expertise, their team, or leveraging teams that are out there in both nonprofit and private sector organizations. Of course, modernization, upgrades, there's a lot of state applications that are going through modernizations. That takes a lot of work on the local level. That doesn't mean costs just for the state. That means costs for the counties, cities, towns, and villages. And all of these disaster recovery, there's large broadband initiatives going on. These would bring the most value. And this is all in the report on our website. So I'm going to go through it a little bit more quickly. I really like this one, increase the staff pay and education of their IT department. They're learning that cross training is important, especially as they managed people during COVID. So the question about how much ARPA money is your local government getting? How much is earmarked for IT and cybersecurity? This is, we had 25 local governments answer this, and you see everything is approximate. And there were some that were able to make the justification for use in IT and cybersecurity. There was also some that made the case for its use there and was not funded or either was not consulted during that process. So I think we see a lot of the same things, cybersecurity and modernization, security cameras. Down here, we see the boardroom and technology for hybrid meetings. There's a lot of investments continuing to go on in the virtual meetings. So number 7, and I will make sure that I stay in time. What do you think of the long-term positive and negative effects on local government IT departments? So positive effects, appreciation and understanding of the role IT plays. And I heard this in stories of people saying, I never knew everything that you did to keep our government running, and now I understand. And even just the statement means a tremendous amount. This has translated into funding when we did ask another question about budgets. So most of the budgets are increasing slightly. Some are increasing a lot more. Greater collaboration. There were relaxed laws and regulations during this time to make work easier. Everyone said remote work is a model that works. There's departments in some counties that are never going back in the office. They've been so productive in their remote work model. Greater citizen adoption of services. So if you have to make an appointment to go in, or you can do that online with a virtual call, they've seen a tremendous uptick in citizens' adoption of e-government services. Appreciation for planning, cooperation across entities and jurisdictions. So jurisdictions in geographical similar areas were working together. So the negative effects. Short-term IT responsibilities will become long-term without adequate resources to support. In many of the locations, the virtual public meetings, even though there was a concerted effort to educate everyone on how to work that, they were asking IT leaders to stay in those meetings. So now they had all the COVID responsibilities, they had the remote work responsibilities, they had the regular work responsibilities that you saw, and now they were being asked to stay in virtual public meetings. So that adds on, even though the user education went well, people just feel better with someone there. Long-term effects on IT staff and exhaustion. This is one of the things we're looking at right now. There is an increased stress level that almost mimics when the remote work started, and it's happening now. And it's because all those projects on hold are now coming to fruition. There are several state large-scale modernization efforts going on right now, and those are creating a lot of stress on the limited departments. Continued and new cybersecurity challenges. Culture and morale has changed. So maybe there's less chit chat even when you came back into the office. I think we all felt this. There's a little bit different in the way you approach and you work with people. There's no running into the office and saying, hey, I have this problem with my computer. It's sending an email. So they're feeling that some people are more comfortable with them coming in to help them, and others want more of a remote type of relationship and working. They saw a lot of the digital divide within their municipalities and their counties, and this is just not rural. So one of the things it brought again to the forefront is that it's not just access, it is the funds in order to access the infrastructure that already exists. And then supply chain implications. There's many places still waiting for purchases that they made. So this was a really quick snapshot of some of the items that we've learned. The report is on CTG's website along with lots of others in this area. It was great to get everyone back together. It was great to hear how they were adapting, and that there has been some change from this whole movement to e-government services and remote work.
Thank you, Megan.
Thank you.
Appreciate it. It's always interesting to hear a perspective from a group like that, particularly a group that was so critical for a lot of the transitions that we saw over the past 2 years. Our next presentation today is from Peter Fiduccia. He's a PhD candidate at Cornell University, and he's going to be presenting on learning through lag, measuring education inequality through internet latency. Peter?
Thanks so much, Laura. Appreciate it. And thank you to the Rockefeller Institute for the opportunity to speak today. I'll go ahead and get started with screen sharing. And so I'm here to talk about internet lag and specifically the geography of latency in the United States. And we want to start by talking about where we'll go today. Again, a pretty brief presentation, but one that I hope will outline this new measure of inequality that we want to talk about, not only across New York State, but across the United States and frankly, the world, as we have shifted from a pretty legitimately long-standing way of working and learning to a new normal. Forgive the often used description that we've been using across society over the past few years. So again, these global shifts that we've seen in work and learning. The COVID-19 pandemic, as Megan pointed out, has had widespread implications across a variety of sectors, specifically employment and schooling. But also, and something that we don't always bring to the forefront, is that this has impacted home networks as well. As students return to the home to learn from home, as workers and employees shift to the home environment, this extra burden on the home internet network is really taking a toll, and we begin to see these cracks in the system that allow us to ascertain where the opportunities are for improvement. So I'd like to leave you, and hopefully this is a through line that I can make sure that I bring through the entire presentation, which is that access is just the baseline. We can't just think about who has access or what the upload and download speeds. And I think this was something that Megan began to mention. Yes, access is a part of it, but it really should be shifted to being just the baseline. We have to focus on stability. And by stability, I mean internet latency. And as Meghan pointed out in her presentation, there are some elements that should be set on the stage. Forgive me if this is something that is familiar to you. Again, as IT experts, I'm sure some people in the room know this intimately. But there is a difference between bandwidth and latency, and I focus on the latter. And the way that we think about this, and I'm sure this is a crude explanation, but low bandwidth is a small diameter pipe. High bandwidth is a large diameter pipe. More information can fit through a larger pipe. When we talk about latency, we talk about delays due to the travel time. A high latency can be kind of equated to a longer hose, right? It takes longer for information to pass from one end to another. And then the other aspect of latency that, again, I don't mention specifically by title here is jitter, which is the amount of lag or discrepancy between what you see and hear and what's actually taking place. We're all likely on fairly good low latency connections right now, and low latency again translates to very good stability. So as I'm speaking, as I'm Italian, as I'm moving my hands, you're seeing everything happen in real time. If perhaps you, someone on this call is on a high latency connection, a low stability connection, or again, in examples where these low stability connections exist, there would be a lag. You would perhaps hear a word or two drop, or I might freeze up, and then my video might catch up in a few seconds. This may seem like a small element in the broad picture, but if students are trying to learn through this lag, if they miss several key words, or if they are disconnected from the video of that the teacher may be presenting, whether it's a lesson or it's some kind of video content that the teacher is sharing, that can have profound implications on the progress that a student is making through the lesson and through the curriculum and through the entire semester. Likewise, it causes disruptions and can cause lack of understanding between employment and working teams. If someone's giving a presentation or if you're trying to take notes, a high latency connection can cause you to miss things. Right? So I wanted to set the stage and understand what that difference is. So again, I echo this notion that the literature is very comprehensive about internet access and upload and download speeds. But what the literature misses is this notion of latency, the stability of connection. Moreover, it misses kind of the bifurcation of latency by geography, by rurality, which is something that I cover in this work. There's no illustrative empirical landscape about latency in the United States. And then it flows into, there is also a lack of a comprehensive geographic exploration of what internet latency looks like across our country, and specifically in the case of this presentation in New York. What I do want to make sure that I cover that is outside of my work, I don't approach infrastructure of internet access. There are experts who are far more talented than I am that cover that. I don't approach it as a universal right, although I do believe that's a conversation worth having. And I don't talk about funding in this presentation. So the sources of this data, and I'll move through this fairly quickly, is Ookla, a speed test company, where probably most of us are familiar with speedtest.net. If you've ever said, my internet seems slow, what's going on? This is usually the software or the browserware that we use to test our connections. And this screenshot here on the right is an example of such a result from Ookla. Now we see that the ping here is, again, analogous to latency, and we're getting a latency of about 21 milliseconds. We'll see how that comes into play here shortly. I then combine the internet data in a variety of spatial and geographic information systems software and a variety of empirical and methodological ways. I combine it with demographic data from the Census Bureau, which deals with age, some racial construction, and other demographic information. So an important thing to consider that, again, I want to kind of think about it in a broad way and then zoom into our local our local area of New York State. 71% is the percentage of rural population with poor stability internet. That's huge, right? So 71% of the people who are classified as living in a rural area, as according to the US Census, have high latency, aka poor stability internet connections. And we see this exemplified in this map. And to briefly orient you here, the darker areas of the map are the better latencies. Okay, these are low latencies, high stability connections. And we see a common thread that we see in a lot of social science analysis and a lot of broad scale demographic trends, where we see rural areas having poor connections or poor of a variety of constructs that you might discuss. And you see that high population density urban areas have the best latencies. Now we do notice, and I do want to point out, that there is an area in North Dakota where the vast majority of rural census tracts actually have excellent stability. Again, I don't want to get into too much detail here for time's sake, but this was the result of a large-scale state-level investment in broadband infrastructure, which, again, was not about access, or I should say this example is not about access and upload and download speeds, but it shows how state-level investment can reduce latencies that then therefore translate into higher stabilities. And you can see here on the legend that our 21 milliseconds that we received, that I actually got as I was here in my office at Cornell, was a marginal connection. So again, it shows you the difference that we see across the United States. And I'm happy to talk about any of these findings in more detail. I know I want to move through these quickly for the sake of time, but I do want to highlight some very brief elements of the empirical analysis, which show us that on average, rural census tracts, and again, the unit of analysis in this study is US Census tracts. The average rural census tract sees a latency of 80 milliseconds, which is well beyond the lower end of the poor latency threshold of 30 milliseconds. And we see that on average, urban tracts experience a latency of about 20 milliseconds. We can see from a traditional OLS regression that as you increase in your rurality, as you are a rural tract, we expect to see on average an increase of 45 milliseconds of latency as compared to the average urban tract. We also see that it is a positive slope, and in this case that means a worse latency, when you interact being in a rural census tract with an increase in percent school-age children. So we see here directly that this has a negative impact on school-age children in rural census tracts with regard to poor stability internet. And no surprise, as we look at geography across the US, the Northeast is doing the best. That's our comparison group here. And as we move across the other regions, you see increasing latencies. And again, positive numbers here do not mean a good outcome. And then I wanted to zoom in to New York. And we see here that once again, we see an urban-rural disparity. On average, 47 milliseconds is the average latency for rural census tracts, which is again over our 30 millisecond lower bound. And we see the same elements here in the multivariate analysis as well. So again, I want to make sure that we're keeping this element of a broad geographic notion here. And this is a cluster analysis of stability across the United States. So what we're seeing here, and we should be paying attention to the broad swath of dark red and dark purple tracts, and again, this is census tracts, we see that the vast majority of non-urban census tracts in the United States experience high latency, which again is not a good thing. So we continue to zoom in to the Northeast here, and we look at New York State, we see a similar pattern again. And this is again showing us, and just because there are some grayed out census tracts here, that's not because they are not valid in the latency calculation just because it's below the statistical significance threshold. But this next slide again highlights stability across New York using the color scheme we saw in the earlier slides. And this shows us that once again, not surprisingly, New York, downstate, Long Island, and some might recognize the military bases in the North Country experience excellent latency. They have very low latency figures. And we have some census tracts across the I-90 corridor that have fair latency. But the vast majority of census tracts, and as you can see, the vast majority of these tracts are rural, experience poor latency. They're having unstable connections when they are utilizing their home networks or frankly, any networks in those areas. So in order to move away from this doom and gloom, we don't want to say that everything is bad. Of course, we want to present solutions. There is a solution here which has been started in the southern tier, and this is, again, this is fixed broadband. So this is continuing the trends of the visualizations that I have been showing you. We can see here that all of these census tracts are poor, are experiencing poor latency, above 30 milliseconds. So how do we create a solution? Some of the solutions that have been proposed and that have worked very well are investments in mobile broadband. So one example here is some of you might be familiar with a private firm, Southern Tier Wireless. And this is a map now of mobile broadband networks. And this is not 5G and 4G on your cell phone. This is broadband being broadcast via a mobile tower. Or rather a tower which broadcasts broadband so you can pick it up via an extender or another hardware device. And we see the drastic change between the fixed broadband, and this is pipe that's laid in the ground, fiber optic networks, things like this, and the mobile broadband networks. And we see that this is now, for the vast majority of these tracks, excellent latency figures, or at least marginal, which would not result in a significant disruption to either the Zoom classroom or an online employment and working environment. So as we move forward, new era, new goals. Access may exist where stability does not. So I'm trying to get across here that we must start to think in the terms of latency. We must start to have that as part of our policy lexicon, where we're looking at stability and not just access. We understand that there's rural and urban disparities in a variety of public policy and social science constructs. This also must now be brought to the forefront as a new measure of rural-urban disparity. There's an opportunity here to invest in mobile broadband to reduce latency, and we know that state-level investment works from the example we've seen in North Dakota. And I'll preview some work just in this sentence to say that there are more detailed racial and demographic analyses coming down the pike with regard to spatial variation of latency across the United States. So I want to thank everybody for the attention and to today's presentation and for the opportunity to speak at the conference. And I would welcome any comments and questions both here and after the session via email.
Thank you, Peter. That was very interesting. And as you invited questions, I invite everyone on here today to submit their questions to the Q&A to kick off the conversation after our third speaker. And I would now like to invite David Massaro, Deputy Chief in charge of Special Operations at the City of Schenectady Fire Department, to present to us on the Schenectady Fire Department's telemedicine program. David? I think you're on mute.
There we go. Sorry about that. I'm a fireman. We don't do computer stuff. All right. So good afternoon. Thank you for allowing me to present today. I apologize, but as I talk, it will generally be very fast, but I will try to limit my use of us and ums as much as I can. But welcome to the Schenectady Fire Department Telemedicine Program. So quickly about us, we were formed in 1899. At our peak, we had about 10 stations and just around 180 firefighters. Today, we have about 120 firefighters in 4 stations, and we respond to roughly 20,000 calls, with 12,000 EMS calls making a pretty significant chunk. All right, so early telemedicine. We probably all got our first look at telemedicine watching the show Emergency with Johnny and Roy calling Dr. Brackett at Rampart General Hospital. They used something called the biophone and a LifePak 4. So that biophone was pretty ingenious in that it allowed paramedics to speak to the doctors right at the hospitals regarding any medicines or modalities that they needed to perform. It also allowed them to transmit telemetry or ECG rhythms, meaning heart rhythms, directly to the doctors for review. And then those doctors would look at those rhythms and then let the paramedics do whatever modalities they were requesting. So Schenectady Fire's introduction into telemedicine was very similar. We had LifePak 5s and then transitioned to LifePak 10s in the early to mid 90s. And we used something called an AppCore, which was very similar to the biophone. The AppCore was the Advanced Portable Coronary Observation Radio. So it was very similar. It allowed us to transmit ECGs to the doctor, allowing the medics to consult on different rhythms and request medicines or modalities as needed. And we no longer, though, at this time, needed to get permission to give medicines and modalities. We had protocols in place. So we would just use the AppCore as a different tool for contacting the doctors. So then in the 2000s, we kind of transitioned a little bit as technology improved, so did our capabilities. So instead of using an AppCore, which is a big, clunky piece of machinery, weighed about 40 pounds, we were able to now just contact the medical direction on a simple handheld radio. And it was much more efficient and much more reliable than the AppCore. And then we also were able to upgrade into what was called a LifePak 12, which gave us just crazy technology based versus what we had capable in a LifePak 5, LifePak 10. And then in the early 2010s, we transitioned to cell phones. It was much more reliable than the radios were. It allowed us to really get connections where radios might not have good service. As you can see, we had the Nokia that everybody loved, and then in the later teens, we were able to transition to the iPhone and even more reliable networks. And also we were able to transition from a LifePak 12 to a LifePak 15, which allowed just an absolute increase in the amount of patient information that we were able to pass on to the doctors. So then telemedicine today, this is where we are today. So we still use LifePak 15, which is an amazing thing. But now we're able to transmit large quantities of data, not only with the LifePak 15, but now utilizing iPads, we can even have face-to-face interaction with doctors and provide patients with that resource. So telemedicine program, what were we thinking? Why did we come up with that? It was early on in the pandemic, right? It taught us many lessons. Hospitals were experiencing overcrowding. Patients were spending many hours in the emergency room waiting for beds to clear up on the floors. Wait times in the emergency rooms themselves, the waiting room could be hours and hours in length. Ambulances were frequently waiting in excess of an hour just to transfer patients from their stretchers to ER beds because of this overcrowding. And as a result, 911 crews and patients were waiting for those same ambulances to clear the hospital to come to calls that we needed to transport. So basically this whole thing was a terrible circle that we realized we needed to break somewhere. The whole mutual aid system was severely taxed. We were running out of ambulances and wait times were just becoming intense. So why telemedicine? Well, we realized there had to be a better way of providing care to our community. Right. Insurance companies are promoting their own versions. MVP had their GIA, CPHP had something. So we realized that was a capability now with the increased technology. We would be able to utilize for a percentage of our responses this same telemedicine idea. So we partnered with a company to provide telemedicine. And we designed the program with kind of 4 things in mind. We wanted to provide our citizens with emergency care that they asked for, but in their home. We wanted to try to ease the flow going into the emergency room. We wanted to make emergency room beds more available for the critical patients. And then we wanted to increase the availability of ambulances in the area. So not only does that serve, we're not transporting to the hospital, but we're also allowing the hospital to discharge patients and free up beds up in the floors that would otherwise be tied up with patients needing ambulances. So we identified a kind of subset of patients that would be appropriate for utilizing telemedicine. We realized that while this is a fantastic technological advance, it isn't necessarily something that's appropriate for everybody. So it wasn't an all-inclusive list, but we did come up with a bunch of different ailments like general illness, aches and pains, fever, medication refills. Basically, any patient that had a basic life support complaint, like a BLS complaint, not I'm having chest pain or my family fainted or there's an obvious break, things that we're very comfortable in allowing them to stay home. Those are the patients that we try to utilize this program for. And we touted this as having some benefits, right? So as we were talking to those patients, we had a list of things that we wanted them to know. We could treat patients at home within just a few minutes, right? We're able to log on and give a series of questions to a call taker. And then that patient can get transitioned over and we can have a face-to-face doctor versus waiting hours and hours in the emergency room. We can just within a few minutes, they can be talking to a doctor. We have medication that's available right on scene. They don't need to go to the emergency room to get medication. We have an abundant supply of different kinds of medications in our drug boxes that we're able to give those patients without having to go anywhere. We can get a prescription assigned right from the doc on the telemedicine, the iPad, to the patient. And then we collaborated with local pharmacies for home delivery of prescriptions. We also tried to collaborate with local agencies for transportation to follow-up appointments, meaning like follow-up with urgent care or follow-up with their primary care or follow-up with ortho, any kind of appointments that need. And luckily, the plan was to eliminate long emergency room wait times and then make more ambulances available for hospital discharges, meaning they could discharge patients home. Now there's beds free on the floor for critical patients in the ER to transition up. And then that breaks that cycle of not having ambulances and everyone overcrowded. So we developed a handout to give to patients. So on calls that seemed appropriate, we would give them a quick handout. Next time you call, please be ready for telemedicine. This is something that we're going to offer. This is something we're going to provide. And we left these at different agencies as well. All right, so we identified some stuff. So besides that handout to the patients, we posted flyers in different community spaces to alert our residents to this new program that we were doing. We had a press release and a news conference just to help push the idea that there was something new that Schenectady Fire was trying to not only provide our continued patient care, but better patient care, and that now they're able to kind of stay home and receive everything they need. So we posted it on social media. We had an informational booth at a whole bunch of community events, and we continue to this day to stress this public education. So we developed the program. We figured it out. We developed the program, and now fall 2020, we rolled out this telemedicine program in two of the busiest apparatus, just to try to work out the kinks and see what was necessary. We went department-wide in kind of like the late spring of 2021. So it's a pilot program. We're still working out the kinks. We're still figuring out how to make everything better and increase our capabilities with the community that we represent. So about 300 patients utilize this service, and we continue. Again, I'm stressing it's public education. We're trying to make sure that the public in Schenectady knows about this program and is aware of all the benefits from this program. Because we're trying to break a cycle of people calling 911 for community medicine, for their primary care, going to the hospital for things that they could stay home, or even at some point transition more to an urgent care setting. So community education has been basically our huge priority. So with that pilot program, we identified through analytics, some key areas for improvement. So as I said, we were able to partner with a local a local pharmacy to provide prescription delivery, which was very cool. It was something that we were able to offer a lot of our residents, including those that were homebound and not really able to get out and receive things. And again, we were able to transport with a couple different agencies, contract with a couple different agencies within the Schenectady County to provide transportation services to those patients as well. And we just tried to improve our community engagement, whether it was on calls, whether it was in events, schools, hospitals, the ER, wherever we could. We tried to push this program and the capabilities that it has, and stress that it's better patient care for those citizens that need it within our community. And I did say I would talk super fast. I apologize. But thank you so much. And here's my contact information, and I'll be here to answer anything in the Q&A.
Thank you, David. I appreciate it. Very fascinating program. Again, I'd like to remind the audience to submit questions for Q&A. And thank you for turning on your cameras. And I have a question for you, David. I'd love to hear a little bit more about how the community's responded to this. Have they been appreciative of it? Are they taking advantage of it? Do you see repeat customers?
So as it stands right now, the usage was pretty low through the pilot, but it was a new program, right? It was people that are generally very used to going to the emergency room. Now we're saying, no, you can stay right home. You can get what you need right here. You can talk to a doc super quick. So there was definitely a transition process of getting people out of the mindset that if I call 911, I'm going to hop in the ambulance, I'm going to go to the hospital. So once we did a re-rollout with some of those increased services like the delivery, prescription delivery, and the transportation, we have seen a pretty significant, I know the number was small to begin with, but we have seen a significant bump in our usage since that re-rollout. And we're hoping that as we continue to stress that community education, that we'll see those numbers climb.
Now, if there was another department thinking about implementing something like this, what would be the lesson that you would share with them? The number one thing that you learned in the rollout process that they could ease their transition? Public education. Okay.
That has to be their priority, and it has to continue to be their priority, because we're looking at a community of 60,000 residents. So in an effort to reach all of them, it's difficult. Some like the paper, some like the news, some like social media, some like the radio, billboards. So there are dynamics that we're trying to advertise and push information out. It's just a matter of trying to reach everybody. And this day of technology, sometimes it's hard.
Great, thanks. Megan, I have a question for you. Now that your members and the people that jurisdictions have had some time to think about how they're going to implement some changes for the longer term, I was wondering if there's any talk, what's the talk of coordination, possibly shared investments and things, looking at potentially doing some shared services? Are they considering coordination across jurisdictions and municipalities moving forward?
So the best kept secret is that they've been coordinating and doing shared services under the radar for many years. Okay, so in records management, in some broadband efforts. So the answer is yes. So they're beginning to, those projects are having a resurgence, but they're leveraging their purchasing power together. So it's items like that, but there's so many projects that go on in the smaller municipalities, especially with their counties, that we don't hear about. So there are shared services already occurring. I think there's a lot of knowledge sharing around the applications that they had to set up around COVID, and there was a lot of information sharing on their closed listserv about, so some health departments, there was some groups of nurses who maybe didn't have the right module in their system that they wanted. So they wanted to use an Access database or an Excel spreadsheet. They would put out the call to their colleagues and say, even if you're not using the same system as me, what are you doing? And of course, anybody who lives in that world knows you do everything possible to not create another Excel spreadsheet or Access database to gather data. You figure out how to build out the module of the system that you have. So there was a lot of helping that goes along with that. So the answer is yes, some large scale shared service projects, but also this knowledge sharing that occurred for the everyday challenges that came up.
Great. And Peter, I enjoyed learning a little bit more about the latency metric. And what struck me, just a question about the metric itself. You have measure by census tract. And is there variation within that census tract by provider or by service used?
Great question. And I think what probably will preempt that is how the information is aggregated. So the actual data comes from UCLA, as I mentioned, and comes in the form of 1 by 1 kilometer tiles. So there's an aggregate of information that's in the tile that tells us the average latency within that tile. And then that's aggregated up to the census tract. As we know, blocks would be too small and you'd have a little bit of overlap. So there is variation at the tile level, which if we were to do an analysis, say at the New York State level, that might be interesting to vary the spatial unit. But as you know, when you do that, you introduce a little bit of noise that isn't necessarily great for a broad scale analysis.
Right, right. But in theory, I guess census tract would give us income and the relationship between racial and the access differentials in latency.
Exactly. And again, for the sake of time, didn't get into all the detail here, but in the broader analysis, I do find that, again, sadly, not surprisingly, we see that as percent of non-white population increases in census tracts, we see that latency figure increase. Yep.
So with that $65 billion in broadband and internet access funding coming out very soon, how would you encourage policymakers to incorporate latency in their decision making in allocating those funds?
Absolutely. And I would say that this is yet another opportunity for cross partnership and public-private work in your community, right? This has to be a local adventure. This cannot be, we have $65 billion for infrastructure. Let's just lay fiber down everywhere. That's not going to be the answer. You have to go into the communities and find out if fiber is already there, where are the latency spikes? Is it because someone lives a mile or 2 miles or 3 miles or 10 miles away from the nearest hub? And go into the community and find out where these mobile broadband ventures are doing well, because that is far less expensive than laying down fiber. A single tower as opposed to miles of fiber is going to save time, is going to save money, and based on this research is going to be a better latency figure anyway. You're going to have better stability.
Mm-hmm. And I think you touched on the education component of it, but I think telehealth in the longer term is going to be a bigger impact for this for places that have rural communities that have challenges accessing healthcare programs.
100%. That's my other paper. So you took it right out right there. So.
Yeah, but Laura, one of the other things that's part of the broadband money is the focus on digital equity. And so one of the things that we've been exploring and talking to folks about is how are communities going about that digital equity, because you do have to carve out a piece of that money for that purpose other than just addressing infrastructure issues. And so I think that's going to be one of the next conversations is how communities are focusing on this digital equity area.
And I think equity is going to be really important because we have to talk about affordability. We have to talk about quality of access. The focus to date has been just getting access. And I think, is this a question that local IT people are going to be thinking about moving forward? Are they going to have a say in the broadband distribution of broadband funds?
So many do have a say in it. They play a role in discussions around it. There is a project going on in the city of Yonkers that took with the STEM Alliance and the Westchester Business Association, I believe. But the city of Yonkers found that they had a digital equity problem even with the infrastructure in their city. So it became more of an education and awareness approach. So yes, I'm starting to see more IT leaders think about this as part of their portfolio, in addition to all of those functions and responsibilities that I listed before. It's thinking about the community in that way, and they're being asked to weigh in on that.
And David, was access to internet and equipment and digital hardware a challenge in implementing this in Schenectady?
Thankfully for us, it really wasn't. Because our administration and our local government, the mayor and city council, have been kind of on the forefront of technological advances, so that, you know, they've established a significant Wi-Fi presence within the city. And so, you know, the purchase of the iPads was probably the most expensive thing that the fire department itself had to do. But, you know, we had Wi-Fi pretty much throughout the city that we were able to tap in. So that, I mean, that was a resource that was fantastic. And, you know, it continues to grow every day. And that really was one of the pushes for telemedicine, was like, hey, we've got this, let's use it. Let's make this accessible to everybody.
Well, thank you, David, Peter, and Megan, for a really fascinating conversation today. It's been great to learn the different perspectives and have three very different looks at one particular topic. So thank you for your participation today, and I hope everyone in the audience joins us for our final session this afternoon in about 15 minutes.
Thank you,
Thank
Laura.
you, everyone.
Thanks
Thank
for
you
the
very much.
opportunity.
Bye.
Bye-bye.